Dr. David Kulla here with Synergy Wellness in New York City. Today we've got another case of adhesive capsulitis with a shoulder subluxation. So he has his clavicle is out of place, so is the glenohumeral joint, and he now has adhesive capsulitis. So I did a video on adhesive capsulitis, a really good video where I explain, which you saw, right?
Yeah, I saw.
Yeah. Explaining adhesive capsulitis and what exactly it is and who it affects and what are the best treatments. So I'm not going to go into all of that jazz because we're going to put that video up here so you can just click on it if you want to learn more about adhesive capsulitis, why people get it, the signs, the symptoms, the best thing to do for imaging and all that jazz. You can watch that video. This video, we're just going to show you guys how we treat it. There are a number of ways to treat adhesive capsulitis. I'm putting some cream here on him because we're going to do some GRASTON technique. So this is a stainless steel tool that we use, and it's a little painful. You okay? Mm-hmm. And this is meant to bring more blood flow to the area. It's going to loosen up some of the muscle adhesions that he's dealing with adhesive capsulitis. And go ahead, raise your arm up forward as high as you can for me. Okay, so that's a lot better than what it was. Yeah. The other visit, our first visit. This is his second visit, and you know, some cases take 8 to 10 weeks to get through. Just depends on what stage you're in of adhesive capsulitis. His is not that bad. I've seen worse cases. So you can see here his skin's getting red. And we're going to just get in there a little bit more. You okay?
Yeah, I'm fine.
Hang in there. He's biting his tongue under that mask. He says he's fine, but this is painful. Adhesive capsulitis can be very uncomfortable. He had some really sharp pain about a week or two ago, which really brought him in here. He's been dealing with this for, what, 6 weeks now? 8 weeks?
Yes, almost like.
Yeah. And adhesive capsulitis, you really need to see a physical therapist or a chiropractor for it. Don't try to go it on your own and treat it on your own. You could try doing the exercises if you find some online, like the ones that we did in our other video, and see if those help. If it's not getting better, though, you need to go see a therapist or a chiropractor, somebody that knows how to treat adhesive capsulitis, okay? Because it could get worse, and it could develop into just other issues, more problems, and you just don't want to go there. Treat it quickly, get through it, and you'll be glad you did, trust me. Okay, so we just did some GRASTON technique. You'll see his arm is pretty red there. If we zoom in, we can see that. Okay, not too bad, but that's normal, okay? That is absolutely normal. Now we're going to use cold laser. This laser is amazing. It reduces inflammation, reduces muscle spasms, and also, importantly, will reduce his pain levels as well. But before we do that, we want to wipe off any excess cream there. Give me a second. Now go ahead and raise your arm up for me.
No problem.
Well, that looked a lot easier. You weren't kind of struggling up here. Was that easier for you?
No, it's better.
Yeah. So we just broke up some of those muscle adhesions. This laser does that as well, but gets deeper in there. And then after that, we're going to go ahead and adjust his clavicle, and I'll show you how we do that assessment. And this is how we best treat adhesive capsulitis. Again, some physical therapist offices will just do the manual therapy. There are different ways to do manual therapy. You have manual therapy with hands-on, which I did on him last time. You have the manual therapy with tools, with instrument-assisted devices, usually made of stainless steel. You have techniques like ART, active release technique, which we did a little bit on him last time as well. So those are just myofascial, soft tissue techniques. Any one of them will work and are effective on adhesive capsulitis, any one of them. So I like to switch them up. Sometimes certain techniques work better for people or are less painful or uncomfortable for some patients. So I mix them up a little bit. And this laser here, just holding on for about a minute and a half at each spot, not even. This is a 25-watt laser, so pretty powerful laser. We even have 50-watt lasers. So that really, the wattage depends on the treatment time. So the higher the wattage, the lower the treatment times. We're just going to basically laser over the biceps tendon and the deltoid muscle. And then we'll get one spot in the back here where the rotator cuff attachment is. And then he'll be able to raise his arm even higher without pain. Did you have any pain when you raised your arm up to the top?
No, for the moment, no.
No? Okay. This can come from being sedentary. Some people don't think they're sedentary, but they are. And as I said in my other video, it develops people from 40 and up more commonly, but you can get it younger than 40. So, and on a scale of 1 to 10, how bad was your pain last week when it was really bad? 10 being the most.
Let's say like 10.
It was like a 10 out of 10. Okay. Yeah, so he couldn't even sleep in it. Okay. He has his clavicle out of position here too, and we don't know what that's from. That could be from just sleeping on it. So if you sleep on your shoulder on your side, it's possible to develop a subluxation here of the sternoclavicular joint. And we're going to laser this for the next 5 to 10 minutes, the whole shoulder, and then I'm going to show you guys how we do the sternoclavicular adjustment. Okay, we have now just finished doing GRASTON technique on his shoulder, cold laser therapy, and now we're going to go ahead and adjust the shoulder. I want to show you something though. If you look here at my thumbs, everything looks balanced, right? Everything looks really balanced. That's a good sign because I adjusted him just about 3 days ago.
Yeah.
4 days ago, a couple days ago. So I want you to go ahead and lay on your back. So his sternoclavicular joint held for the first few days. That's a really good sign. Okay. Now we're just going to go through and check the shoulder here. So I want you to put your hand, can you put your hand under your back like this? Still no. Okay. All right, no problem. Just relax here. So we're going to do a little bit of GRASTON here on the pec muscle. And it's going to hurt him a little bit. You okay?
Yeah.
Hang in there, buddy. Okay, now I'm going to use this to loosen it up a little bit. It's not as painful. Okay, now I want you to put your arms out here in front of you, like this. I'm going to push down. I want you to resist me. Don't let me push down, okay? Straighten your elbows, good. And 1, 2, 3, resist. Okay, so you can see how this one gives out pretty easy. We're going to go ahead and adjust his shoulder here, the glenohumeral joint. So I'm going to have you sit up, face the camera. Sit right here. Okay, and just relax yourself here. Bend this arm here. Just relax here. Let it go. Okay, good. Now lay on your back. Good, and arms out again. Yep. Okay, and same thing. 1, 2, 3, hold. Good. Better. It gave out at the very end, but better. Okay, hold there. Put this hand right here. Good. Okay, relax your arm. Go ahead and sit up for me. Yeah. And stand up and face me. Okay, so I just adjusted his humerus, the glenohumeral joint. And sometimes that can cause the clavicle to come out. So go ahead and lay on your back. Face up. Face up. Lay face up. Lay on your back. Mm-hmm. So he is from Albania. We live here in New York. We get a lot of people coming from all over the world. Slide up. So sometimes I speak fast. Turn face that way. Yeah. Not sometimes. I always speak fast. I'm a New Yorker, so. Okay, good. Relax here. This is probably the most uncomfortable adjustment that I do. Okay, let's say it. It's the most painful adjustment that I do. But it's not that bad, considering the pain that people are already in, okay? So what I just adjusted right there on his neck is the nerve supply to the deltoid muscle. That's this muscle that's preventing him from raising his arm up. Really important to check and to correct. Okay, sit up again, and I want you to raise that arm. Go ahead and raise that arm up for me. Okay, okay, good. Drop it down. You are all set. I sent you some exercises. Have any questions about those?
I'm good with those.
Okay, you're all set.
Thank you. Thanks.
All right, thanks for tuning in, everyone.